you got a personal story, I mean, it's fine, but I mean, you know what I mean? It's just like, it's theater for them. For me, nothing is theater. I'm fed up with theater. I have very short tolerance. I'm not a politician. I can't even pull it off even if I wanted to.
I don't think you could, no. You have many skills, but that's not one of them.
All right. Good morning, everybody. Thank you for attending today's COVID-19 Truth and Accountability Roundtable. I want to thank the Heritage Foundation for hosting us. I want to thank our witnesses being here, my colleagues for getting here, obviously just a couple days after Election Day, and we're not even technically meeting until next week, but a lot of folks came into town today because this is such an important issue. We think it's important to be demonstrating to the American people that the people's business need to continue, and this issue is particularly critically important. Today we have with us Dr. Scott Atlas, Dr. Martin Kulldorff, Dr. Jay Bhattacharya, who have been voices of reason throughout the COVID-19 pandemic and bring immense expertise in public health. It's disappointing we have to hold this discussion off Capitol Hill. We're pretty close, but despite the reckless policies from lockdowns to vaccine mandates, our Democratic colleagues refuse to seek accountability for what has occurred over the past 2 years. Our hope today is that this will set the stage for the 118th Congress and that Republicans will deliver real change and accountability in the next Congress. Before we get started, today's roundtable is an open discussion. It's not styled like a traditional hearing. We'll have 4 topics to guide our discussion for about 25 minutes each after we hear from the witnesses. We will start with the pandemic response, then discuss medical censorship, vaccine mandates, and then end with a path forward discussion. Members can jump in at any time, but I'll ask that we keep our remarks brief and have an honest and open inquiry with our expert witnesses. When we get close to the time limits for our discussion, I will give a warning. I'm going to start by introducing the witnesses. Dr. Scott Atlas is the Robert Wesson Senior Fellow in Health Policy at the Hoover Institute of Stanford University. He's also Senior Scholar and Founding Fellow of Hillsdale College's Academy for Science and Freedom and co-director and co-founder of the Global Liberty Institute in Switzerland. He's a frequent policy advisor to policymakers and governments in the United States and other countries. He has served as senior advisor for healthcare to several candidates for president and members of the United States Congress. From July to December 2020, he served as a special advisor to the president and a member of the White House Coronavirus Task Force. Before his health policy appointment at Hoover Institution, he was professor and chief of neuroradiology at Stanford University Medical Center for 14 years. Dr. Martin Kulldorff is a biostatistician, an epidemiologist, and a professor on leave in the Department of Medicine at Harvard University, a senior scholar at the Brownstone Institute, and a fellow at Hillsdale College's Academy for Science and Freedom. Dr. Kulldorff's research centers on developing and applying new disease surveillance methods for post-market drug and vaccine safety surveillance, and for the early detection and monitoring of infectious disease outbreaks. In October 2020, he co-authored the Great Barrington Declaration, an international open letter with nearly 1 million signers that decried lockdowns and called for a risk group-focused approach, advocating for a pandemic strategy of focused protection instead of lockdowns. I'll introduce Jay Bhattacharya, who is going to be about 10 minutes late because he's coming from another forum in town. Jay is a professor of medicine at Stanford University. He's a research associate at the National Bureau of Economics Research, a senior fellow at the Stanford Institute for Economic Policy Research and at the Stanford Freeman Spogli Institute. Dr. Bhattacharya's research focuses on the economics of healthcare around the world, with a particular emphasis on the health and well-being of vulnerable populations. Bhattacharya was also one of the 3 authors of the Great Barrington Declaration. Before I hand it off to our witnesses, we are going to play a video sent to us from our friend Janice Dean. Ms. Dean joined the Fox News channel in January 2004, where she currently serves as senior meteorologist for the network. She lost her mother-in-law and father-in-law in long-term care facilities in New York and has been a vocal advocate against Governor Cuomo's disastrous policy that forced our most vulnerable to be exposed to COVID-positive patients, which was covered up by the Cuomo administration. We think it's important to hear from those that have been impacted by the disastrous policies, and with that, we will play the Janice Dean video.
Thank you, Congressman Roy and members of the United States Congress for holding this hearing today, the Heritage Foundation for hosting it, and Drs. Atlas, Bhattacharya, and Kulldorff for your efforts to speak the truth about COVID and our response to it. It's been 2.5 years since the deaths of my in-laws, Mickey and Dean Newman, who contracted COVID-19 in their separate elder care facilities here in New York. Our families were never notified of Governor Cuomo's mandate to send over 9,000 COVID-positive patients into New York nursing homes, and we still don't know why he decided to do it. There were other facilities provided by the federal government he could have used, like the USS Comfort Ship and the Jacob Javits Center. Those went virtually empty. And instead, his health department decided to put the sickest people into the places where our most vulnerable resided. Since May of 2020, myself and thousands of families have demanded answers and accountability into why those deadly decisions were made. But instead of addressing why the tragedy happened on his watch, the former Governor Andrew Cuomo, his administration, and the New York State Health Department tried to cover it up. COVID killed over 75,000 New Yorkers. Over 15,000 of them were our precious seniors. Andrew Cuomo knew early on that if the virus got into the homes of the elderly, it would spread, quote, like fire through dry grass. And yet he continued to flood nursing homes with sick patients for 46 days straight before he finally decided to rescind the order and scrub it from the Department of Health website. By then, it was too late. His COVID-19 wildfire in nursing homes was already out of control and impossible to put out. Andrew Cuomo wasn't the only leader to do this. There were several others that had the exact same wording in their state mandates and barred nursing homes to even test incoming patients. New Jersey, California, Michigan, and Pennsylvania all decided to flood their nursing homes with sick patients despite the desperate pleas from the nursing home directors and the other options they had. Almost 3 years later, we do not know why. We need to know the origins of the executive order that I believe was a death warrant. It wasn't written by real scientists who knew grave danger. Our elected leaders, the one we trusted to keep us safe, put our loved ones directly in harm's way. And then they died without being able to see their loved ones. We weren't able to have proper wakes or funerals. Body bags filled with corpses were stored in storage trucks. Family members were devastated. Our parents and grandparents died scared and alone. New York was one of, if not the worst prepared states in the country. And if we don't figure out what went wrong, this will happen again. But only an independent, no-hold-barred probe with subpoena power can uncover the truth, and that has yet to happen. The investigative reports that were done in New York by State Attorney General Letitia James and our comptroller Tom DiNapoli found that the Cuomo administration initially undercounted nursing home deaths by half and had a strategy to cover up the true results amid a federal probe. This was a Category 5 disaster and requires urgent priority, and I will continue to advocate for as long as it takes. Just because Andrew Cuomo no longer is in power doesn't mean the rest of us are done with trying to hold him accountable. Because although our loved ones can never defend themselves, it's up to us on their behalf to keep using our voices for justice on their behalf. And thank you for having me today.
Well, I want to thank Jana. She wanted to be here. She's made herself available for future hearings when we get the gavel in January, and I'm sure she'll join us then. But I thought it was important because she's been such an important voice for this on Fox and in general about the impact on humans, on real lives. We're going to talk more about that here today. I'm going to go ahead. I'm going to move a little bit out of order. I'm going to offer a few thoughts to set the stage here. I was going to do after remarks, basically to buy a little bit of time for Jay. And then I'm going to turn it over to Dr. Atlas, Koldorf, and then Dr. Bhattacharya. Let me just start by saying that while some are suggesting a so-called COVID amnesty, we are instead asking for accountability for the lies and the injustice resulting from government response to COVID. For the first time in American history, public health bureaucrats ground the strongest economy in the world to a halt, shut down businesses they deemed, quote, non-essential, and forced an initial 14 million people out of work. They then demanded, and Congress provided, $5 trillion in spending to try to save what they had broken. They masked up our healthy children, kept them from going to school, forced them out of playgrounds and off athletic fields and from walking across the stage at graduation. And in so doing, set them academically back a generation. They prevented us from attending church, from even attending funerals. They prevented us from going to public parks, getting fresh air and exercising. They forced the elderly to die alone in hospitals and nursing homes with no loved ones at their side. They forced fathers out of delivery rooms, separated from mothers in labor with their own children. They forced Americans, including our military, our border patrol, our nurses and first responders, to choose between losing their paycheck and taking a vaccine that received immunity from liability while makers such as Pfizer and Moderna banked $100 billion in profits. They forced doctors to choose between speaking the truth or keeping their medical licenses and engaged in the great silencing of free speech through big tech and political pressure. They ignored natural immunity. They ignored and swept aside dangerous side effects, seeking not truth, but a political end result. And guess what? None of this stopped COVID. We now know lockdowns had no effect on reducing COVID-19 mortality, and instead we got 108,000 dead Americans from drug overdose deaths, the most in American history. We got a 100% increase in teenage alcohol and drug-related deaths. We got children attempting suicide at higher rates. We got historic learning losses not seen in 30 years, and a broken economy with record inflation. Americans are dead, lives have been destroyed, and our nation is weaker because of reckless government decisions, federal, state, and local. Let me be clear. While many beg for amnesty, these actions demand accountability. This is the first step now, 2 days after an election, with Republicans taking a majority. Republicans have an obligation and a duty to expose the truth and to seek the truth through the power of subpoena and the power of committees when Republicans take the gavel. And with that, I would like to turn it over to our three great experts, and we will start with Dr. Scott Atlas.
Okay, thank you, Chairman Roy and distinguished members of the panel. Thanks for the opportunity to speak today about the SARS-2 COVID pandemic, specifically to clarify facts and consequences from the management of the pandemic under two administrations, and to give my thoughts on how to restore trust in America's public health, science, and our universities, key institutions we need as a free and ethical society. In a democracy, indeed in any fair and free society, truth is essential. That's why I'm here, to set the record straight for the American people and to ensure that this never happens again. First and foremost, the consequences of the coronavirus pandemic and its management have been enormous and tragic. Over 1 million American deaths have been attributed to that virus. Even after more than a year of draconian measures, there has been an undeniable failure over 2 presidential administrations to stop cases from rapidly escalating and preventing hospitalizations and death. The tragic failure of the reckless, unprecedented lockdowns and the added massive harms of those policies on children, the elderly, and the poor are indisputable and well documented. This was the biggest, the most tragic, and the most unethical breakdown of public health leadership in modern history. As a health policy scholar for more than 15 years and a medical scientist for more than 25 years, I was asked to help my country during the biggest health crisis in a century. I worked hard with a singular focus to save lives and help Americans through this pandemic. All policy considerations I recommended to the White House were designed to reduce both the spread of the virus to the vulnerable and the harms of the policies themselves to those impacted the most. To determine the best path forward, should policymakers not objectively consider both the virus harms and the totality of impact on public health of the policies themselves? That is the importance of health policy experts, my field, with a broader scope of expertise than that of epidemiologists or virologists. In fact, the current data continues to support the positions I advocated for during my tenure as advisor to the president. But instead, we have seen an Orwellian attempt to rewrite history, to blame those who criticized the lockdowns that were widely implemented for the failure of the lockdowns that were widely implemented. History's biggest failure of public health policy lies directly at the hands of those who recommended the Birx-Fauci lockdowns and those who implemented them, not on those who advised otherwise. The data shows the Birx-Fauci guidance was an abject failure, implemented under 2 different presidents, including an administration now already having the vaccine. The United States COVID deaths per million are even worse than almost all of our peer nations over the course of the pandemic. Beyond that, their lockdown policies caused massive death and destruction, severely harming millions of families and children, especially the working class and the poor. The lockdowners and the university experts who recommended lockdowns and demonized the alternative own the outcomes. Their policies were implemented, their policies failed, killing and harming millions. It's also important for Americans to understand lockdowns were not the accepted pandemic management for 15 years prior. The safer and standard alternative is targeted protection and ending the lockdowns, and that was described repeatedly in national media in March of 2020. Ioannidis on March 17th, 2020, Katz on March 20th, 2020, myself on March 26th, 2020, all called for increasing targeted protection to people who had a risk to die and ending the destructive lockdowns. 7 months later, in October 2020, the Great Barrington Declaration also called for targeted protection of the vulnerable and ending the already destructive lockdowns. That was authored by 3 renowned medical scientists and epidemiologists, Dr. Kulldorff, Dr. Gupta, and Dr. Bhattacharya. It is blatantly false to claim that I or anyone else was a proponent of letting the infection spread without mitigation, the so-called herd immunity strategy. My advice of focused protection to stop the death of the elderly and the high risk while safely reopening schools and society to minimize the death and destruction of the lockdowns was not accepted in the United States, with rare exceptions like Florida. Despite the known data on extremely low risk to children and severe harms of missing in-person schools, school closures, as recommended by Drs. Birx and Fauci, and the majority of so-called experts in academic science and public health, were implemented in the vast majority of the country. In the United States, the harms to our children from those school closures are a heinous legacy of those who recommended and presided over that policy, with well-documented explosion of mental health care visits for teenagers and college-age children during the lockdown, a doubling to tripling of self-harm visits in teenagers, that's extinguishing cigarettes on their skin and slashing wrists, massive explosion of manic depressive and anxiety disorder visits to doctors by college-age students, overdoses and substance use disorders in teenagers, increasing by 40 to 120%. These are from the lockdowns, not from the virus. At this point, all legitimate policy scholars and government leaders should be re-examining the policies that severely harmed America's children while failing to save the elderly. The widely implemented social lockdowns and significant restrictions were worse than a failure. They were reckless, they were deadly, they were extraordinarily harmful, and they have been proven to be so. In Bjornskov's study of March 2021, the lockdowns did not reduce deaths. In Ben David's study of January 2021, the lockdowns did not prevent the spread of the infection. In Agrawal's study of June 2021, the lockdowns led to increased excess deaths. In Herbie's Johns Hopkins study of January 2022, the lockdowns had little to no effect on death, but they imposed enormous economic and social costs. And in Kirpin, Moore, and Mulligan's study of April 2022, Florida and South Dakota, states that opened early, were among the states with the best performance on mortality, education, and employment, and the worst performing states were those with most stringent lockdowns: California, New Mexico, New York, Washington, D.C., and New Jersey. Insofar as lockdowns and school closures during this pandemic being a measure of an ethical society, America's leaders fell far short. In terms of censorship, a poisonous interplay to stop the free exchange of ideas between America's media, big tech, academic science, and public health has severely harmed the public. 3 examples from my experience stand out, but we were all censored. On September 11, 2020, YouTube pulled down a lengthy interview I had done 4 months earlier, before being named as advisor to the president. On October 18, 2020, when I was advisor to the president for COVID, Twitter decided to block my account rather than have the American people hear what the advisor to the president was saying. On March 18, 2021, Florida Governor DeSantis assembled me, Martin Kulldorff, Jay Bhattacharya, and Sunetra Gupta for an expert panel. The panel's video was taken down, censored by YouTube through its, quote, medical misinformation policy. Governor DeSantis showed the courage to call me up immediately when that was done and organize another panel with me, Martin Kulldorff, and Jay Bhattacharya to highlight this dangerous attempt by big tech to selectively stop the public from hearing information. University professors were also aggressively trying to silence the scientific debate by character smears and defamation, and in doing that, expose themselves as political animals while endangering the public and being shameful role models for our children. In conclusion, First, we all acknowledge, and we must acknowledge, that the consequences of the SARS pandemic and its management have been an enormous tragedy. Over 1 million American deaths have been attributed to the virus. As I said, all legitimate policy scholars should be re-examining those policies that severely harmed America's most vulnerable and shifted the disease burden from the affluent to the poor. Bizarrely, though, many want to blame those who oppose lockdowns and mandates for the failure of the very lockdowns and mandates that were implemented. And others, as Congressman Roy pointed out, call for simply forgetting the heinous, unconscionable decisions that were made to close schools and implement reckless lockdowns that killed and destroyed millions. That must not be allowed. Not if we have an ethical society. The public needs to know the truth after all they have been through, and not if we are to succeed in the next pandemic, the next inevitable crisis to come, and not if we want to restore trust. That requires a public admission of failure, a public apology by lockdown advocates, and that public admission must be required to add accountability to those in power so they never impose these reckless, destructive policies again. Thank you very much.
Well, thank you, Dr. Atlas. That was powerful and helpful, and we'll look forward to engaging with questions on that. I'll welcome Dr. Bhattacharya. Thank you for coming for your other panel that you were doing here in town. And I've already introduced you, and thankfully I think you already know your credentials, so you don't need to hear them again from me. But thanks for being here.
Thank you for having me. I apologize for being so to come all the way across town, so I apologize for.
No, thank you. I'm just sorry you had to spend time with Ovik Roy, my good friend, by the way, for the cameras there. Dr. Koldorf, the time is yours.
Thank you very much, and thank you for getting us all here and for inviting us. I appreciate that. At the beginning of the pandemic, I was scared for about 10 minutes. When the virus hit northern Italy and Iran, which was the first places outside of Wuhan, it was clear to me that this would be a worldwide thing. The virus would reach every corner of the world, and that was obvious to any thinking infectious disease epidemiologist. There was no way we were going to stop it from arriving. But I looked at the data from Wuhan, the very earliest data on mortality, and the age of people who died from it. And from that, it was obvious through a few minutes of calculation that there was more than a tenfold difference in the risk of mortality from COVID. So anybody can get it, obviously, but the risk was more than 1,000-fold by age. So as a parent, I like most parents, I value my children's lives more than mine. So from this, I knew that they were going to be fine. My 3 kids were going to be fine, as well as any other children. Now, from this information on the relative risk of mortality, it was equally obvious that the right approach was we needed really to put a lot of effort into protecting older, high-risk Americans, while there was no point in closing schools. We need to let children and young adults live their normal lives. Because if we don't, we'll have all the collateral damage on education and public health and so on. So I tried to, I wrote about this and I tried to publish it here in the US, but I guess a Harvard professor with 20 years of experience with infectious disease outbreaks was not worth reading. So I was unable to publish anything here in the US. In my native Sweden, I had no problem publishing op-eds in the major daily newspapers. Now, in August of 2020, I finally managed to get in a piece in CNN, CNN Espanol. The English version did not want my contribution. Of course, after the Great Barrington Declaration in October 2020, it was no longer a problem getting heard because we sort of pricked the bubble that the perception was that there was scientific consensus for lockdowns, even though most of my colleagues that I knew personally thought it was a bad idea that went against the principle of public health that we've been living with for decades. So that Great Barrington Declaration was able to prick the bubble of consensus. There was no consensus in the scientific community for lockdowns. At that time, instead of being silenced, we were slandered. There was an organized campaign against us, both from NIH director, as well as in the UK. And we were censored by YouTube, by Twitter, by LinkedIn, Facebook, and so on. So I think that there were many things that went wrong with this pandemic strategy. Two of the major things was our not using standard public health measures to protect the elderly who were at high risk. And many died unnecessarily because of that failure. The other one is the closing of schools, which is going to have long-term consequences. Also, people didn't get medical care for other things, like diabetes or cancer and so on. And those numbers, doesn't show up immediately. But somebody who would have lived for another 15, 20 years might not die of cervical cancer 3 or 4 years from now. So these are things that we have to live with now and die with for several decades. In terms of the science, the most surprising was the questioning of natural immunity. If you go and read the old Greeks, they explain that during the Athenian plague in 430 BC, they talked about natural immunity, that if you have recovered from the disease, you can take care of the sick patients without being severely affected by it. So we have known about natural immunity for 2,500 years, except about 2.5 years ago, suddenly we didn't know about it anymore. That's stunning as a scientist. And this questioning of natural immunity comes from CDC, from top universities, from hospitals. So nurses who were taking care of COVID patients during the beginning of the pandemic, many would catch COVID and recover. Now they have natural immunity, but a year later they were fired by the same hospitals that they have served because they didn't need a vaccine. They already had better immunity than the vaccine immunity. And we know that it's the natural thing that if you're recovered, you typically have better immunity than somebody who's vaccinated. That doesn't mean that vaccines are bad. It's just that if you've had the disease, you don't need them. It's very important to evaluate the pandemic strategy, and I thank you for all coming here and starting that process today. It's also important to reform how public health and science operates. And a huge problem in science is the centralized system. Within each area of science, there's sort of a cartel system where people control the funding and the publication in the top journals and so on. And we actually saw during the pandemic that some of the best and most important information didn't come from the US or the UK, who's traditionally the powerhouses of the scientific community. It came from smaller places like Iceland, Denmark, Sweden, Israel, and Qatar, who is not quite as dependent on the centralized system because they have more independent funding sources. So to resolve this problem, we have to sort of break that up and have science function in a less centralized and more decentralized manner. Otherwise, I think we will have seen the end of the age of scientific enlightenment. So thank you so much.
Dr. Koldorf, thank you for that. Dr. Bhattacharya, the floor is yours.
Thank you. Thank you for inviting me to come, and thank you for the opportunity to start this discussion. I think the focus on evaluating what happened during the pandemic and the failures of policy are tremendously important, because if we don't, it'll happen again. And it's something that absolutely needs to have attention for the highest levels of government. Early in the pandemic, I was asked during a podcast about where on the world I'd most rather be in the middle of a global pandemic, and I said the United States, because I had confidence then in our healthcare system, our scientific establishment, to work hard to understand the problems, work hard to move resources to protect the vulnerable, and I thought, there really isn't any other place I'd rather be. Looking back, I was tremendously naive. The United States has had a tremendous failure in its management of the pandemic. And the source of that failure, I'm sorry to say, is in fact the federal government, and as well as the many state public health agencies many state public health agencies that mismanaged the pandemic. To justify this, I want to just give some sense of the kinds of a major theme of the pandemic has been misinformation, controlling misinformation that's come out in social media and other settings. The primary source of the most important problems in misinformation have come from the federal government itself. The primary source of misinformation has been the federal government itself, and it has worked. It's used its power to manage the control the spread of information in social media. It's used effectively propaganda techniques in order to destroy the reputations and careers of people who spoke up against to try to correct these ideas of misinformation. Just to give you some sense of what they a few. I could go on for quite a long time. Martin mentioned the idea that immunity occurs after you have disease. That is absolutely true. This is a coronavirus. It was really clear by spring 2020 from elegant studies of mechanism of immunity that was likely to be true in this case. We didn't know how long immunity would last. We didn't know exactly the mechanisms of it, but we knew from very early on in the pandemic that if you get COVID and recover, you would have pretty strong protection against both reinfection and then if you are reinfected, the severity of reinfection. During the pandemic, especially after the vaccines came available, public health agencies denied that. And in fact, on the basis of denying that, put in place very destructive vaccine mandates that led to the loss of jobs and careers of many people, and created a counter reaction that has led to the undermining of I think the consensus that most of the population had that vaccines were a really good idea. And we're seeing the fruits of that in the resurgence of polio, reductions in childhood vaccination rates, which I think are tremendously damaging. A second one. Remember, early in the pandemic, people talked about how masks weren't particularly effective in controlling spread of a highly infectious respiratory disease. Even Dr. Fauci said that at one point, I think in February. That was reflecting the consensus based on dozen or more randomized studies, good randomized studies with the flu, where mask mandates and large-scale masking in populations did not actually control the spread of the flu. For no apparent scientific reason, that consensus was reversed overnight, and the federal government started emphasizing the use of cloth masks to stop the spread of the disease. We knew then, and we know now, it was not effective. And that embrace of cloth masks almost certainly led to unnecessary deaths, as many vulnerable people who would not otherwise have gone into public during times of high spread went out in public with cloth masks thinking they were protected because of what the federal government told them. Schools. Martin mentioned evidence early on from Iceland, from Sweden. It was contrary to many other respiratory diseases, where really kids are a source of, you get common colds. Anyone who has kids knows, that you spend their toddlerhood, you get colds, right? That's just normal. This disease didn't act that way, and we knew that very early on. Kids do get the disease, but they don't drive the spread of the disease in the same way some of these other respiratory viruses do. We knew that from studies in Iceland. On the basis of these studies, in spring of 2020, Sweden decided to keep all its schools open from age 15 on down, with no restrictions, no masks, just normal school. The results of that convinced much of Europe to open up its schools, both in spring and then in fall of 2020. The United States went in the opposite direction, especially blue states. My kids in California, for a full year and a half almost, didn't see the inside of a classroom. We're now seeing the negative consequences of that. The learning loss is tremendous, and there's a literature from before the pandemic that measures the return on what happens when you from schooling by a negative way. Well, what happens if you stop giving school for a little while? It turns out that has lifelong consequences for kids. You make kids skip a little bit of school, and they will lead shorter, less healthy lives. One early estimate in the U.S. from the spring closures alone suggested that we had cost our kids 5.5 million life years from the school closures. 5.5 million life years. The idea that schools, it was necessary to close schools, never had it in order to stop the disease from spreading, never had any scientific support, and has led to tremendous damage that we're going to be paying for a good long time. The idea that the vaccine can stop the spread of the disease. Well, the randomized trials that were run in 2020, which were actually pretty good randomized trials, but they didn't answer that question. Yet, nevertheless, public health authorities embraced the idea that everyone had to be vaccinated in order to stop the disease spread, without evidence to suggest that that was true. I've been a strong supporter of the vaccine for older people. I think the vaccine does reduce the risk of mortality for older people. But for kids, it's very unclear whether it's worthwhile or not. Nordic countries have decided that it's not worthwhile and have not recommended it. You know, the state of Florida, the public health there decided that looking at the evidence, the balancing the risks and the benefits suggested that it's not something's routine. If you have a vaccine that stops spread, maybe you can use it to get rid of the disease or suppress the spread to zero. But if you don't know that it doesn't stop the spread, and then very early on in 2021 it became clear that it didn't stop the spread, you shouldn't be using the vaccine that way. I could go on, but I want to give you all time for questions. But the primary source of misinformation has been the government itself, and that it used its power to suppress scientific dissent so that the public couldn't know, legislators couldn't know that scientists disagreed with what the government scientists were saying.
Dr. Bhattacharya, thank you for that, and appreciate you guys coming here and testifying. We're going to go to questions now, and the way we're going to do this is we're going to do a segment here on pandemic response, and we're going to do about 25 minutes, and I'm going to ask my colleagues to try to keep your questions to 1 minute or less, and you guys, if you can, try to answer it in 1 minute or less so we can get around here and get questions and answers back and forth on the pandemic response. That first. Second, we're going to do a panel after that on medical censorship. Dr. Kuldorf talked a lot about that, but all three of you did. Then we're going to do a third panel on vaccine mandates and on vaccines. And then we're going to have a fourth panel on what do we need to do going forward. So I just ask my colleagues to kind of stay in those parameters. There's a clock over here. I will try to stay within those confines. And I'll say that Dr. Bhattacharya, my father had polio. You just said something that interested me about the extent to which the reaction and the government response to COVID has now created an environment where polio is now resurgent. Can you please explain that?
What I've seen from talking both extensively with people who had been, very strongly in favor of vaccines, but a lot of parents are now saying, well, if I was misled about the efficacy of this vaccine in the context of COVID, well, was I misled about these other vaccines? There's a resurgent movement, skeptical about vaccines, that I don't think has more power now than I've ever seen it in my career. And it is, I think, a direct result of the overselling about this vaccine and the denial, for instance, of that this vaccine does sometimes cause injury to people, especially young men with myocarditis. I think that the imposition of vaccine mandates in particular created a reaction that has undermined essentially the almost universal consensus among people in the United States that childhood vaccines were smart. And that didn't just happen here in the U.S. It also happened elsewhere. Childhood vaccine programs around the world, Africa, India, actually were suspended during the pandemic. And as a result, polio has come back. I'm quite afraid that some of the other diseases, measles has come back in Africa. I'm quite afraid that many of the protections that we had against these diseases have been undermined. I don't know how to get the public trust back so that we can actually get back to a place where we don't face those risks anymore.
Thank you for that, Dr. Bhattacharya. I'm going to turn it over to my colleague, Congresswoman Green. I know she has to get somewhere in the next 10 minutes or so. So, Congresswoman Green.
Thank you. Thank you for coming and talking with us today. I'm pretty shocked at hearing your stories, and it makes me wonder if your medical degrees and your experience in medicine is somehow considered less than those that were chosen and their advice on COVID-19 to be basically the government and controlling everything. I can't imagine that your opinions, your experience, your knowledge, your studies, and your careers are any less than the other doctors like Dr. Fauci who gave guidance that led to COVID shutdowns. My question that I have for you all, considering that we've talked about over 1 million people have died in nearly 3 years now, but we've also talked a lot about how many businesses were shut down, many of them permanently, how many people lost their jobs, how many children were kept out of school for longer than a year, 2 years, and even longer. Children were masked, people were masked, we were masked, all of us. People were forced to take vaccines that they didn't want to take. We were all shamed, censored. As a matter of fact, my Twitter account got permanently banned. One of the tweets I got permanently banned for, I retweeted my friend here, Thomas Massey. So we were talking about there shouldn't be COVID vaccine mandates.
Always a danger.
Of course, he'll get you in trouble.
Do that at your own risk.
But here, and I have over $100,000 in fines from Nancy Pelosi because I didn't want to wear a mask. I didn't think it was healthy for me. Janice Dean's testimony about what happened in New York to me is unbelievable and unforgivable. Now, doctors, this is my question I'd like to hear each of you. If you make a mistake in your treatment of a patient, you can be found guilty of medical malpractice. You can even be found guilty of manslaughter if someone dies for gross negligence in your care. That's by our laws. Now, what the federal government has done here in the United States, especially talking about what Janice Dean described happening in New York, where Governor Cuomo completely ignored the 2 ships that were sent for medical care for COVID patients, and instead all these COVID patients went into nursing homes. And then we're looking across the country, and there's thousands of reports on the VAERS system, and that none of them have been investigated of vaccine injuries and deaths. Should we consider, or how do we look at this, if you can be held accountable for medical malpractice and a mistake you make with patients, and there can be manslaughter charges gone against you if you make a mistake, how do we look at this in regards to the decisions made by the federal government? Dr. Atlas, I'll start with you.
Well, it's a complicated question. I think there's something that is first not complicated. This is the biggest fiasco and biggest break of ethics in the conduct of public policy, and specifically health policy, in our history, probably, certainly in modern history. And that needs to be acknowledged. And accountability is a very important part of preventing this from happening again. Similarly, accountability, like I said, is very important in the public eye so that it never happens again. We cannot do nothing and have no admission of error. On the other hand, I am not for specific punishment. This is just my personal opinion. I'm not a lawyer. I don't know what's legally, in legal jeopardy or not. But I think that if Congress, in my opinion, as a citizen here, spends a lot of time punishing individual people, I don't see how that is a sort of unifying theme on the way to move forward. I think, yes, there has to be recognition that heinous errors were made, and the motivations for those errors, I'm not sure, are very clear. It's beyond incompetence, although, believe me, I was in the task force room. I saw incredible incompetence and a lack of preparedness. On the other hand, it's more than that. I think there were breakdowns in ethics, and there are several ways we can move forward, which we'll talk about later, that aren't about punishment, but they're about fixing what needs to be repaired, including some of the things that Martin alluded to with the funding of science, including getting rid of these career bureaucrats. We must eliminate a bureaucrat with that kind of power who's sitting in the position of advising on health policy for 38 years. I'm speaking of Dr. Fauci. As just one example, we need to get rid of the bureaucrats that are occupying all of the agency positions. There are tremendous conflicts of interest that are not just financial. I could go on, but the biggest issue to me is we need to have individuals with integrity rise up. And what does rise up mean? Rise up means step up, have a spine, and understand what's right and wrong. And I think that has been a gross failure. And part of the reason there's been a failure is because we have a politicized media and a politicized university campus. And that, instead of encouraging good people who are independent to step up and help, they have discouraged it. They have caused a tremendous amount of self-cancellation. We have tremendous colleagues. I happen to be sitting in a group here that has a lot of courage, but there's not a lot of people like that. And we have seen on our campuses a tremendous amount of self-cancellation by otherwise good people. Because of this vindictiveness and poisonous sort of atmosphere, we have had a loss of what I call basic human decency in this country. And so I'm not sure that punishing individuals, I'm going much longer than my 1 minute, I'm sorry, but I'm not sure that sort of a vindictive search to punish individuals is going to be productive.
Thanks, Dr. Ellis. Dr. Kuldorf and Bhattacharya, if you guys could answer that question relatively quickly, and then we'll move down the line.
I agree with Dr. Atlas that this is the biggest public health fiasco ever. You asked about Anthony Fauci and if there are other experts maybe. And I think it's important to realize that Anthony Fauci is not a public health scientist. He's a lab scientist. So he knows a lot more about virology than I do, but he doesn't know much about public health. And it's very surprising that he became the expert in an area that he's not an expert in. Now, why didn't other people speak up? Well, there are thousands of public health experts who know this better than Fauci, but he sits on the biggest pile of infectious disease research money in the world. That makes people think twice, 3, 4 times before they speak up.
Thank you.
So a couple of things about that. So first, I think a lot of the worst things that happened were actually were intellectual errors, right? So for instance, take what happened in New York State and other places where COVID-infected patients were sent back to nursing homes. Why did we do that? Well, if the goal is protection of hospital systems, well, that's what flatten the curve is about, right? If the goal is protection of hospital systems, yeah, of course you do that. Send COVID-infected patients out of hospitals to nursing homes, clear up hospital beds. That's the right thing to do, right? If the goal is protection of vulnerable people, you would never do that. It's ridiculous. It was an intellectual error to say that we should protect hospital systems instead of protecting vulnerable people. That should have been our when you have the wrong goal, you'll have the wrong policy. What do you do in medicine when you have a patient that dies? You have a thing called an M&M conference, a morbidity and mortality conference. The goal is to you get all the doctors and other healthcare workers in the room that were managing the patient where the patient died. You honestly say what went wrong. The goal isn't to point the finger. The goal is to reform so that you don't make that mistake again. I really strongly think that that's the spirit we have to move forward, because there's a lot of people, some good people, some not, but mostly people trying to get it right, adopted unethical strategies. There was financial interests at play, a lot of things at play. But I think a spirit of let's reform our system so we don't do this again. It will be better served if we have a very broad coalition of people involved.
Thanks, Dr. Bhattacharya.
Yeah. Thank you.
And with that, I'm going to turn it over to my friend from Kentucky, Thomas Massey.
Thank you, Chip, for organizing this. In December of 2020, Pfizer came out with their test results of their trial. They had like 30,000 participants, and then FDA characterized those results, and then CDC characterized those results in an MMWR. And I had already had COVID, so I was actually considering taking the vaccine. So I wanted to know if the trial had any thing to say about those with prior natural immunity. And what I found in the MMWR is they had a very shocking result that they reported that CDC said, and I'm going to read it to you, very short sentence. Consistent high efficacy, greater than 92%, was observed across age, sex, race, and ethnicity categories and among persons with underlying medical conditions, as well as among participants with evidence of previous SARS-CoV-2 infection. I thought, what an extraordinary claim. I didn't realize they had people with previous infection in the study, so I went and looked at the data. Turns out they had accidentally recruited about 1,200 people in the study, and as you would expect, about 600 ended up in the placebo category and 600 ended up in the actual take the vaccine category. They had exactly one infection in both groups at their significant endpoint, which was only a week later after the, okay. So I called up the CDC, and I recorded these conversations. And at first the director said, I'll get our top scientists online. So they got the top scientists online. She said, oh my gosh, we don't know how we made this mistake. At first I'm thinking, what the hell? A politician found a mistake from our CDC? Like, this is like life or death. And we're going to call you Eagle Eye Massey here at the CDC from now on. We will fix this. And they assured me they would fix it. And I said the reason it needs to be fixed, like you, Dr. Bhattacharya, I was, at the time, believed that it would be effective and maybe necessary for elderly people. And in Kentucky, there were young people getting the vaccine who had already had SARS-CoV-2. They were put in the front of the line because they were in the accounting department at Humana, which is a hospital organization. And there were elderly who couldn't get the vaccine. So I implored the CDC to fix this mistake so that the allocation of the limited vaccine could be corrected. They said they would. 6 weeks later, I go to their website. They have not fixed a thing. So I called them back up, and they agreed to fix it. And here's the new sentence. They said, our third paragraph, fourth sentence should have read, consistent high efficacy greater than 92% was observed across age, sex, race, ethnicity categories, and among persons with underlying medical conditions, period. Efficacy was similarly high in a secondary analysis, including participants both with and without evidence of previous SARS-CoV-2 infection. Here's what they did. They had separated these groups. They knew who had had evidence of prior infection and who didn't. And they knew they had no evidence to show that it worked. In fact, statistically insignificant negative efficacy among those with prior infection. And they just lumped them all together. Their secondary analysis was, we'll just look at all of the people together and then just make one broad statement because we can wash out the statistical significance of those, what we found that there was no evidence of those with prior infection receiving benefit from this vaccine. So my question to all of you, like this would be the equivalent is if you did a study of some health treatment for black people and white people. And you had a smaller number of black people in your study, and what you discovered is you found no efficacy for this drug among black people. But you decided to print that it worked. When you did a secondary analysis, you found out that when we include all black people and white people, we find it's 92% efficacious for all of them. My question to you, is this how you do science? Is that a valid analysis to be able to make that statement, to put all of the groups into one category when you've already studied them separately? Dr. Bhattacharya?
No, absolutely not. I mean, I think what you have is clinically you have a very important fact about people. Are they COVID recovered? That determines a very strong input into the efficacy of some treatment, in this case the vaccine. You have to take that into account. If you're going to give clinical advice, you have to take that into account when you're doing the study so that you give advice, okay, and actually it's not just clinical advice. Here, there were vaccine prioritization questions. You know, the vaccine was relatively scarce in January 2021. If you prioritize people that have not had COVID before, you're likely to save many more lives. I actually wrote an op-ed about this in India, because in India they face an even more severe shortage of the vaccines that they had available then, arguing that you should take that into account and prioritize older people who had not had COVID before. And then I gave testimony in Congress, where some congressman yelled at me about like arguing against people taking the vaccine, when I argued instead that we ought to take exactly what you said into account. That's the right thing to do. When you have a good evidence that it's protected for one group and less good evidence protected for another group, and especially if that first group is vulnerable, use the vaccine in that group, the people who've never had COVID before. Prioritize them. Don't prioritize people who've never had the vaccine, especially when the evidence from the trials themselves doesn't give you any reason to think it would work among people who'd already had COVID.
Thank you, Dr. Atlas.
Yeah, if I can just add something to what Jay just said. This is just one example of grossly substandard science that was published by the CDC. And I'm not sure if it was willful or not. I have a feeling that no one could be that incompetent as to think that that was a good study, although they published a mass study on 2 hairdressers in a beauty salon that I think is infamous at this point, and said it was very important. My view is they published, frankly, garbage science. This is the leading agency in the world, the CDC, by general assessment. They published garbage science to sway the public. Okay, this is an unethical use of public health policy. Public health policy is supposed to persuade people by facts, by the data, not with an agenda, not with a non-transparent study. I mean, this was really, again, I'll use the word unethical. It was shocking when I saw this, and it was repeated over and over again. Second point I want to make, just to clarify the actual data, as Martin said, we rely on other countries for data because we frankly cannot trust the CDC data now. Israel published what I consider the definitive study comparing non-vaccinated people who've recovered from COVID, who've had COVID but never been vaccinated, versus people who've never had COVID but were vaccinated. This was studied and published in mid-2021, and it showed that people with recovery from COVID without the vaccine had a better protection against infection, a better protection against symptomatic infection, a better protection against severe infection, and a better protection against death, people who've recovered from COVID without the vaccine, than the people who had the vaccine and never had COVID. So this ignoring, Martin likes to say 2,500 years, and he's right. But I mean, this is fundamental science that you learn not in medical school, not in a PhD program, not in college. You learn it in high school AP biology. This was denied by our so-called experts in the CDC. I mean, this is unconscionable.
Isn't one of the things that makes that study definitive or significant the number of participants? Was it literally in the Israeli study? Millions. They literally used their entire population that they had records on. Dr. Koldorf, would you? And by the way, Dr. Atlas actually already answered my follow-up question. So if you would answer 2 of my questions like Dr. Atlas did, is it legitimate to take 2 cross-tabulations that you have when you know that for one subgroup it showed no efficacy, to lump them in and make a statement to say it shows efficacy for all of them together? And but the follow-up question is, what was their motivation? Because I let them know it was wrong. They acknowledged it was wrong. And 6 weeks later, when they fixed it, they didn't fix it. And it's still on their website today. So what is their motivation to deny natural immunity?
I don't know what the motivation is. In this situation, it's not valid to put the groups together. And there's a reason why Pfizer and Moderna actually asked questions about prior infection. And that's the vaccine to have much benefit in that group, even before they did the trial. So they designed it to be able to look at efficacy specifically to those who have not had infection, because that's how you maximize the statistical power to detect an efficacy, if there is an efficacy. So they designed they did the correct thing to collect that information. And the correct primary analysis was to exclude them from the study. What was wrong was to try to pretend that the results for people who had not had COVID was also somehow relevant to the people who had COVID. That was a major mistake, and I think an unethical mistake.
That's fascinating. I didn't realize that's why they separated, to show that they would have more efficacy, because if you included those who you suspected it would have no efficacy for, it would lower your number. Yeah. Fascinating. Thank you.
I thank my friend from Kentucky. We've got about 5 or 10 minutes on the response section here, maybe 5 minutes. Is there any of my colleagues want to speak to this particular question on the response? All right, my friend, Mr. Biggs from Arizona.
Thanks, Chip, for holding this, or I guess Mr. Roy, yeah. So, Dr. Atlas, you and I spoke in May of 2020 on a podcast. We spoke about the COVID-19 responses based on politics rather than scientific facts, and earlier this week, American First Legal released information suggesting Biden administration policy decisions were driven by the Kaiser Foundation's political polling. It's a liberal political nonprofit and publishes polling on healthcare issues. So just one example of the politicization of public policy related to COVID-19. Can you provide us with other examples of how this response was politicized?
Well, my opinion is there were several examples of people being political in this, including by the people who were supposedly the chief scientists behind the pandemic response. Early on, when I was there, I was in the White House from beginning of August through mid-November 2020, 3.5 months. And before the election in October, there was a calculation made by simply looking at the incidence of the infection in the population during the clinical trial of the vaccine, that it would be likely true there were enough cases by mid-October 2020 to have the data looked at by the outside scientists. And then lo and behold, in mid-October, there was an announcement by Pfizer CEO saying they've decided not to look at the data till after the election. I'm not sure what the motivation of that could be, except they didn't want to hear the news before the election. That was a corporate decision, although the chief person sort of inside the White House environment, inside the administration that was sort of the liaison for the clinical trials, not running them, was Anthony Fauci. There was a politicization of character smear on university campuses. And I think this is very important because universities, while they're not in the government, first of all, they're very dependent on the government, even the private universities. There are more than a dozen university medical centers in this country that get more than $500 million a year from the NIH alone, including my university, Stanford University, that gets over $600 million a year from the NIH alone. There's a conflict of interest there, sort of, and an accountability that might be legislative. But my opinion and what I saw was that, I'll give you an anecdote, really, that was important, I think. There were 3 medical scientists at Stanford University, me, Jay Bhattacharya, and Johnny Anides. We all said the exact same thing about masks not working, about the lockdowns were harmful, that schools should be open, natural immunity was important, many, many things, exact same things. And by the way, I was talking to Jay and Johnny and Anides almost every day about these, yet Stanford professors issued a censure of me in the Stanford Faculty Senate. And when I give a talk on this, I like to show the slide and say, I wonder why. And I have a picture of me standing next to the president at the press briefing. Okay, so what is the problem with that? It's not a personal issue. It's that universities are viewed as the credible experts in our country. University professors are granted a massive amount of respect and position of authority to the public. They're the experts on the TV. They're the experts in the media. And so when we afford these people, university professors, such an automatic granting of credibility, they must have ethical constraint. They must have moral constraint. They can't sit there and sort of smear people unprofessionally and unethically because they're standing next to the president that they personally don't approve of. And so I think this is very harmful to the public good, and they need to be, the universities need to be accountable to the money they receive from the public.
Can I add two quick examples? I promise I'll take more than a minute. One was the CDC consulting with teachers' unions when the decision was made to about opening schools. I mean, I saw that in news reports. I don't know. It just seems utterly outside the bounds. The question to open schools, if it's anything, it's a public health decision. Why should teachers' unions be at the table? The second is the disparate treatment of different kinds of protests early in the pandemic. This is, I think, when people really started to notice the politicization. On the one hand, you'd had the Black Lives Matters protests, and on the other hand, you had like the Sturgis motorcycle rally or other kinds of so some seen on the left, some seen on the right, and public health treated the two very, very differently. And I think it was that was the first moment I really started to think this was going to go really negatively, because public health needs to reach 95%, 99% of the population. It's not like politics where 50 plus 1 is fine. You need 99. And when you have this kind of politicization of public health, it is a complete disaster. You can't have public health work that way.
I think my friend from Arizona on this subject, my friend from Maryland, Dr. Harris, wanted to offer some thoughts, and then we'll move to censorship.
Just very briefly,
Thank you.
yeah, very briefly, and I guess, Dr. Bhattacharya, this kind of follows up on what you said. And I'll ask Dr. Atlas for the scientific evidence. Is there any evidence that those states where they kept, Walmarts and Home Depots and casinos open but closed churches, that they actually had that actually was there's scientific evidence that was the way to proceed? That you basically pick some places, you keep them open, you pick some places, you close them, and was that scientifically based, in your opinion, at all?
No.
I didn't think so. And a point you bring up in your book is, when you make these decisions, look, you need advisors who know virology, who know public health, but in the end, some of these decisions are political decisions. And to me, the decision to close a church and say, I'm going to close a church but keep a Home Depot open with no scientific evidence supporting that is just a bad political decision in my mind. Dr. Kulldorff, part of the pandemic response right now is the question of having doses, mRNA vaccine doses, and giving them to very young children. I got a question for you as a public health person. Look, they're looking at proxy endpoints. They're not looking at endpoints in these studies of whether or not this actually helps children, whether they live longer, healthier lives, but it's how much antibody they produce in response to these doses and these boosters. I'll tell you as a doctor, look, you give someone the mRNA vaccine, you boost them 6 months later, I got to tell you their antibody levels are going to go up. Doesn't mean they're better protected against the new variant. Is this real? Is this public health epidemiology when you're using proxy endpoints in a population in whom you suspect there might be a very low risk of the disease and an unknown risk of the vaccine itself?
Yeah, that's not the right way to do it. Now, the relevant endpoint would be hospitalizations and death. Now, the problem is you can't do randomized trials with those endpoints in children because there are so few. So you would have to recruit millions and millions of kids to do that. I think for older Americans, if we go back to 2021, they were at high risk of mortality from COVID. So even if there's a tiny risk of an adverse reaction, it's still worth taking that risk. For children, we know that mortality risk is almost non-existent, it's minuscule. It's less than for the influenza or a typical season from the past decade and so on. So even if there's a small excess risk of some adverse reaction, that can overwhelm and be larger than the benefit that we know is very, very small.
So this proxy endpoint of antibody levels, it's just a bad idea, isn't it? I mean, and it's what the FDA and CDC hang their hat on. And Dr. Atlas, I know Dr. Atlas wants to...
For the COVID vaccine, yes, it's a bad thing.
Okay, yeah.
Yeah, if I could just, you're hitting on something that's very important that I don't think people that are watching or listening understand. If you look at the data, which I did, that was submitted to the FDA on the vaccines that you're talking about, they didn't use symptomatic infection as an endpoint because the efficacy against symptomatic infection in their own data was after 6 weeks was 31 to 50%. That's not good enough to be approved. They didn't use death and severe disease because there were none in the placebo group or in the vaccine group. So they used what you're saying, which is an antibody response on a blood test to measure it. And as you say, being a doctor, I mean, this is obvious. This is not a very sophisticated knowledge to have to say this, but that is really sort of unconscionable given the fact, as Martin has pointed out, that healthy children have a minuscule risk of a serious illness or death. And frankly, not only was it wrong to grant that, this was granted as an emergency use authorization, which when authorization, it has to be preventing a death that is severe or an illness that is severe or lethal. And secondly, there is no public health emergency to grant an EUA for children to get this vaccine. And I think this fundamental point is never talked about. Where is the public health emergency today to grant an EUA for an experimental drug in healthy children? And if people believe that they think this is shielding others by injecting children, what kind of a society are we that's going to use our children as shields for us? I'm a father. My role is to be a shield for my parents, for my children. They are not to be a shield for me.
Thank you. I yield back.
Well, thank you for that, Dr. Atlas. Thanks for the question, my friend, Dr. Harris from Maryland. We've had a good conversation here about our response to the pandemic. We're going to talk a little bit more about vaccines in a minute, but we want to make sure we have some time here set aside for medical censorship. Each of you have talked about that, and I think it's important to highlight it. Again, this is a preview of where we need to go with longer, deeper hearings in the next Congress. Then this session that we want to cover a pattern of medical censorship throughout the pandemic. Now, each of you have talked about. Two of you are co-authors of the Great Barrington Declaration, which advocated for a focused protection approach by protecting the elderly and most vulnerable and not locking down healthy children. And despite that declaration being completely apolitical, Drs. Fauci and Collins labeled it fringe and did their best to impugn the expertise of its authors and signers. Under the Biden administration, public health bureaucrats at the CDC worked closely with big tech to shut down voices that countered their narrative under the guise of stopping misinformation. Now you have California punishing doctors who speak up under a new law. I'm going to turn this over to my friend from Florida, but let me just start really quickly for any of the witnesses. What effect does medical censorship have on the medical profession in the field of science broadly? And then I'm going to turn it over to my friend from Florida.
It's a disaster. It's a disaster. When you have a new disease like this, a new epidemic like this, it is absolutely vital to get the honest ideas and opinions of every expert, no matter what conclusion they come to. You learn the truth by this kind of debate. What censorship did is it's not just that it suppressed the voices of the people that were censored, although that was bad enough. It sent a signal to other scientists that, look, these areas are too controversial. Stay out of them. Otherwise, you're going to lose your reputation too. And as a result, you have this illusion of a consensus that never existed on so many topics. We robbed the American people of a true debate, a true discussion about this. I mean, it's not that we're always right. I mean, Lord knows that's not true. The issue is the truth comes from people honestly engaging with the data. Censorship kills that. Censorship kills science, and I think censorship actually killed people during this pandemic.
Thank you for that, Jay. Dr. Bhattacharya, I'm going to turn it over to my friend from Florida.
Thank you all for being here, and thank you, Chip. This is incredibly helpful and instructive. Though I'm a lawyer, not a scientist, I have great reverence for the scientific method. As I understand it, it requires constant research and hypothesizing and then testing that hypothesis and then, interpreting and analyzing the data, not in a linear fashion, but continuously. And I'm increasingly concerned about conversations I've had with academicians, researchers, and physicians who fear as though engaging in that scientific method could result in them losing their license to practice medicine because medical boards have been very punitive against those who were engaging in what I just thought was science. I'm reticent to excessively use the powers of Congress to do most anything, but should Congress be thinking about legislation to limit the ability of some of these professional boards to constrain the scientific method by threatening their constituent members?
Well, I'll take a shot at it. I'm not sure that Congress is the right vehicle. I'm hoping that the courts are the right vehicle for this. As a concerned citizen about even the politicization of courts, I'm not so sure that's going to pan out. There is nothing more harmful, more chilling than these laws like the California new law where Jay and I live on so-called misinformation, because patients are going to suffer from this. Patients already have suffered from self-cancellation by doctors who are afraid to say the truth to their patients, who are fired from their hospitals, et cetera. So, I'm not sure what the right vehicle is for this, to stop this, but it's certainly a horrible trend, because it's not just the censorship of the free exchange of ideas, that's what science is. It's also that there's been denial of fact. There's been complete denial of fact. That's extreme and something that I don't think we've ever seen in this country. So I think there are other ways to make these people accountable, including the fact that they depend on federal funding. They need to be accountable.
While few members of Congress are scientists, we do have a few, like Mr. Massey. I don't know how many judges are, so I don't know if they'll have more or less reference for the scientific method than Congress.
Can I just say something about that particular law, AB 2098 in California? That law effectively puts the CDC in the room with you as a patient and a doctor, so that the doctor is now thinking about what the CDC will say when he or she is giving advice to the patient. And I don't think most patients in the country want that. I think the patients want doctors to care about them and not about what public health is going to think about the advice they're giving to the patient. I think it's dangerous for patients, and I think it's also, just as Scott said, it's dangerous. Dr. Atlas said it's dangerous for the engagement by doctors in public discussions over public health, because that's really the main purpose of it, is to chill that public discussion by dissenting doctors on public health importance.
I think instead of trying to close down debate and censor or slander, what the federal government should do, like NIH or CDC, should have encouraged scientific discourse. So when NIH director, or former NIH director Francis Collins, called Jay and I and Sunata Gupta fringe epidemiologists and asking for a published takedown, what I think he should have done is to bring us in and bring in other scientists, Anthony Fauci or somebody else, to have an open public discussion about these things. And the least thing I would want is to censor those who have a different gives me an opportunity to actually counter their arguments. To counter what they're saying.
And I might learn from them too.
And sharpen my arguments.
Yeah.
I think we're from Florida. I'm going to turn over to the gentleman from Montana.
Thank you, Chip, and thank you all for coming in. This is very valuable information. I hope that a lot more people than the ones that are just here in the room today are able to watch this. From a policy standpoint, what I'm trying to find out is, you touched on it a little bit, but not flat-out censorship from the point of big tech taking control and blocking out what people's actual opinions or what the facts were. But what I'm looking at is from the unilateral, declared emergency powers that a lot of elected and unelected officials claimed upon themselves just because of the misinterpretation of certain codes. How do you believe that impacted the actual outcome of the determination or development of policies?
Yeah, I think there's 2 points I'd like to make on this. One is that what we have seen here is a change in the mission, in the accepted mission of public health agencies and advisors. We have seen a complete abrogation of leadership by our elected officials who are elected to make decisions. They hid behind the CDC. We heard it under 2 administrations. Whatever these guys say is what we're going to do. Okay, that's not, the CDC is not meant to be rule setters or law setters. The CDC is an advisory agency. The CDC is to show data to the public. The CDC is to show science to the public, but not to set rules. So I think that was a huge problem. The part you're pointing out also is very important public policy, and that is the role of the term, there is a public health emergency, unquote, quote unquote, has been abused. And so we need to refine what is the definition of a public health emergency? How long does a public health emergency last? An emergency, and simply in common sense, is something that must be done short term, but in the meantime, because you don't have time to assess everything, but then you get back to looking at it in a very methodical way. We have a country that has supposedly had a public health emergency for over 2 years. I mean, you know, by the way, why does no one look and see that people have been living normally in Florida for 2 years? But that's besides the point. So I think that the public health emergency definition and the time constraints, this seems to be a potential legislative sort of a solution there, in addition to common sense. I think that has really contaminated and really destroyed people, the abuse of that.
Any other questions here from my colleagues on the censorship question before we move to vaccine mandates? Gentleman from South Carolina.
What is your reasoning? I mean, what's your understanding the censorship of the different treatments? You know, when a number of us with frontline doctors who were talking about hydroxychloroquine shut down, where was that coordinated, and why weren't the other treatments able to be brought up, in your opinion?
So what I saw was there was a distinction between on-patent drugs and off-patent drugs and how they were treated. On-patent drugs were essentially pushed through the pipeline. Rapid trials were done. You know, remdesivir is a good example of this. With I think sort of relatively low quality trials, they received approval. What I saw with off-patent drugs is essentially like an incredible slow walking of the evaluation of them. Like there's a study that was just done by the NIH called Active 6 that just studied ivermectin. Just completed, I think, last month. You know, 2.5 years too late, as far as I can tell. Like what should have happened was a rapid evaluation of even off-patent drugs. And in fact, the NIH and the NID had an absolute obligation to the American people to run those studies so that we knew the answer by 2020. It should never have been politicized. Whether the drugs work or don't work is a matter of scientific inquiry, not a matter of political. The problem is that the NIH, and particularly NIAID, failed to run those studies early on. And I have no good answer for you why that is.
Well, I don't think it's easy to say why. I mean, it's very complicated, but I want to reiterate and emphasize what Jay said. This is really one of the unrecognized failures of the NIH here. They did a lot of things wrong, but one of their biggest roles with the FDA was to run the clinical trials. And we had drugs that were cheap, FDA approved, even so safe that they were over the counter in many countries. Yet, and the answers could have been known in a couple of months, a few months in the early part of 2020, and they were not. That was a huge failure of the NIH.
Gentlelady from Colorado.
Thank you so much, Chip, for putting this on, and thank you to all the witnesses who are here today. Appreciate you guys. We've frequently been called COVID deniers just for simply asking questions or presenting information from research that we have. But I would argue that folks on the left are the real deniers. They are deniers of accountability. They are now asking for COVID amnesty because of the terrible policies that they enforced on Americans. They are, as we heard from Dr. Kulldorff here, they are natural immunity deniers, which makes them science deniers. They are freedom of speech deniers. We're talking about censorship here. How many people were censored for simply asking questions about COVID-19, about the practices that were put into use? We even had a disinformation governance board that was formed, and thankfully we were able to get that shut down. That was an attack on the American people to silence them. They are religion deniers. We had our churches shut down. They are assembly deniers. We are not allowed to assemble as Americans unless it was in protest with cans of spray paints and you were setting buildings on fire. And then, of course, they're education deniers. How many of our children have suffered because of the education that they lost. They are parental rights deniers. How many moms and dads were called domestic terrorists for simply defending their children in schools? They are deniers when it comes to the economy. They've even redefined the word recession. So in everything that they do, they are denying the actual truth when we are seeking truth and trying to get truth out there. And ultimately, they are freedom deniers. And that's what we saw most of all throughout all of these lockdowns. COVID didn't lock anything down. It was politicians. It was leftist politicians that shut everything down. And with this talk of censorship, to you all, I want to say each of you, each of our three witnesses here have been routinely attacked for questioning the Democrats' party's efforts to politicize medicine. Two of you were recently attacked after the Great Barrington Declaration in 2020. All this declaration called for was a little more sanity in our national response to COVID, but that was far too radical for the radical left. And your credibility, something that you've worked decades to build up, was repeatedly under fire from the Democrat Party, and all because you wanted to put kids back in school to improve mental health outcomes of Americans throughout our country. And my question would be, all of this was heavily on social media. We were censored on social media. We heard our colleague from Georgia talk about her censorship even. And to the witnesses here today, how could we best counter big tech's war on free speech, on this censorship, especially when you have such credible records to stand on, and you were still attacked, and you still are, and were ultimately silenced for speaking the truth?
Yeah, I think the first thing is the government shouldn't be sponsoring that censorship, should not be directing that censorship. So Martin and I are involved in a lawsuit that's been brought by the Missouri and Louisiana Attorney General's offices against the Biden administration. And what we found so far in discovery is that there are at least a dozen federal agencies that directed the censorship by social media of both ideas and people on COVID policy. So the first thing to do is just stop. Don't do that. That seems like a direct violation of First Amendment rights. My First Amendment rights. Martin's actually really the First Amendment rights of every American citizen. And I think so. You could just stop doing that. On COVID denial, I'd say that in fact the problem is that we actually didn't take COVID seriously enough. If we had, we would have paid attention to the risks that old people faced. We would have done much more to protect older. 80% of the deaths are people over 65. Why did we not take that more seriously? We politicized something that should never have been politicized. We should have taken this much more seriously than we did. Instead, we turned it into this normal political football that should never have happened. We denied basic science, and we suppressed the ability to discuss ideas with one another, which is, I think, our God-given right as American citizens.
Dr. Bhattacharya, if I might, real quick, the gentlelady from Colorado, you just said something about protecting old people. At what point did you know that was the population that we should be spending the vast majority of our time?
Martin should answer this question.
That was known from the very beginning, from the very first data that came out of Wuhan.
Any doubt among the three of you that we knew that from the very beginning? And would it surprise you that for those of us who were saying in March of 2020 that should be the focus, that would have been the right focus?
No doubt.
Zero doubt.
No doubt.
That was known, and if I might say, even without any data whatsoever, a first-year medical student learns that for every respiratory virus, until proven otherwise, the risk is to nursing home people, frail elderly. And the facts for decades have shown that even when a common cold is introduced into a nursing home, people die. So this is not learned. It's very important for people to know it's not learned knowledge that the high-risk people were the elderly and the frail. What was learned and what was a surprise was that the extremely low risk to children. But in terms of the high-risk population being the elderly, that was assumed, and it was known immediately, including on the Princess Diamond cruise ship data. Everybody knew this from day one.
So one more question in the medical censorship field goes to my friend from Pennsylvania, Scott Perry. Before that, I'd like to just recognize my friend Brian Harrison, former chief of staff at HHS and current state rep in the state of Texas, and he's joining us here in the audience. Thanks.
Thanks to gentleman from Texas, Mr. Roy. Gentlemen, thanks for being here. This question, I think, kind of covers the last panel, the current panel, and the next subject, the next panel. And I've listened to you, particularly Dr. Atlas and Dr. Kuldorf, regarding what I would just consider accountability. And I get the sense, I think correctly, that you don't want, you've said, we don't want to punish, but we want to learn from this so it doesn't happen again. And I know you're not policymakers, and I know that you're not in the executive branch where you can, where you can impose a punishment, so to speak, or an accountability. But I think I feel like I need to reset or attempt to reset your thinking a little bit, because in the arena that you're in, your voice is very important. And I would just have you consider this. So the consequences are out there. I mean, you got the governor of Michigan, who's just been reelected. You've got the governor of Pennsylvania, who can't be reelected. You've got the mother of the Pennsylvania Secretary of Health, who was taken out of a nursing home where other people were being forced into the nursing home that were COVID positive. That person has now been elevated to the federal level. And I would just have you consider that there have been no consequences, there has been no accountability, and there will be no change to the things that my good friend from Colorado outlined to you: the censorship, the continual denial of science, the continual politicization of medicine, until there are consequences. Unless there are consequences, I get it that we all want to move past this, understand what happened so it doesn't happen again. But it's continuing to happen. And we're rewarding the people that did it. What do you say to people that lost their loved ones because some policymaker, and I get you don't want to ascribe motive. I get that clearly from your comment. You don't know the motive, right? We don't know what's in people's hearts. But there has to be a consequence. There has to be an accountability for abject, especially when there are life and death issues, especially at this scale. And I would just say, and maybe this is a question you can't answer, and maybe you don't want to get into this, but if you're unwilling to say something about this, if you folks are unwilling to say something about this, this is going to continue, and it's going to be used against us over and over and over again. Thank you.
I'm going to try to be diplomatic. With the question of national immunity is absolutely stunning that existed in the scientific community. That because if by requiring people who had COVID to mandate their vaccines, university presidents and hospital directors are questioning or denying national immunity. The director of CDC in Lancet questioned whether there was national immunity after COVID. To me, that is, I don't understand how we can have people at the lead of CDC, of universities and hospitals, who questions national immunity. That would be like having a university president or the head of a physics department or the head of NASA say that, question whether the earth is round or flat. So how can we have people in the medical field, in the public health field, questioning whether national immunity exists? The evidence is there since 2,500 years, but the evidence is also there specifically for COVID, and it's been there since 2020 in terms of national immunity, and since 2021 in terms of national immunity being stronger than vaccine-induced immunity.
Yeah, I would like to answer your question somewhat directly. And I'm not a politician, so I don't really care what people think of me when I say this. There were two things that stunned me in this pandemic. Number one was this incredible power of the government to shut down everything, to tell people they can't mingle with their own parents, to shut down schools, to shut down businesses. But the bigger surprise was the acquiescence of the American people. And that ties into the answer to your question. I am for exposing these people. I am for public erring and demand for their personal admission of error and public apology. But if we have an electorate who elects these officials, there were 4 or 5 governors who ordered their nursing home infected patients back into the nursing home. And by the way, there was an alternative. Governor DeSantis had separate nursing homes for SARS-positive tested patients. You have to have a brain and a spine. But I can tell you that if you have an electorate that re-elects people who did that to them, then who am I to say there should be a punishment?
Can I just briefly, 10 seconds on that? Because
yeah, sure.
I think the electorate has been misinformed because of censorship and many other issues about COVID science, about COVID policy, and I think that I don't blame the electorate because they're not generally not scientists. They don't pay attention to the evidence. It's the federal public health bureaucracy that caused this. What should the consequence be? I mean, I think people who are put in positions of great authority and then either abuse that authority or make great mistakes resulting in great damage, they should lose their reputation and they should lose their leadership. That's the just thing to happen to them, in my opinion. I think we have to figure out some way forward. I mean, these are not people that you can just throw out. I mean, there's a very large number of people in leadership that failed. How do we move forward from that fact? It's not just one person and say, okay, you're done and that you're gone. You can't just make a scapegoat and pretend like you fixed it. You have to have reform so this doesn't happen again. People should lose their reputations in leadership, but there needs to be some level of forgiveness at the core of this, or else we're just going to be at each other.
Which is good, and so hopefully everybody can last a little bit longer. To the best of any of y'all's knowledge, did any of the leadership at the NIH, et cetera, whether it's Dr. Fauci, Dr. Birx, or anybody in the White House, did they know that there was benefits to, for example, natural immunity that they were then ignoring in their public statements and their actions and advice to the president and taking positions on public? Did they know about efficacy of masks when they were encouraging masks and pushing said policies, or any other knowledge that they knew that they were pushing that helped advance what we've just all been discussing as problematic in terms of the exercise of power by the federal government?
Okay, I'll take that because to say here. Number one, there was gross incompetence, gross lack of knowledge. When there was a discussion at the task force of the meetings I went to, and I was in task force meetings from mid-August to mid-October. After that, I refused to go because it was insane. I was the only one who brought in by Vice President Pence on the risk to children. I had 24 papers there. I went on a 10-minute discourse of the data. Birx and Fauci, I said this in my book, had nothing. I never saw them come in once with a scientific paper into the task force room. The lack of knowledge was stunning. The lack of preparation was stunning. I find it hard to believe they didn't know these basic fundamentals of biology. This is not very complicated at all, but they certainly didn't act like it. There were incredibly low-level discussions about proof of efficacy of masks, for instance. Single charts being held up in the air as proof by very famous, prominent people in that room. So, it's hard to really guess if they actually knew what the motivation was, but they did not show that they knew. They were not prepared. And this is why I say a couple things. Number one, we cannot have bureaucrats that are so powerful in a position for almost 4 decades be in charge of things like that. We need also to incentivize applaud people who step forward, who are good, who are willing to come in temporarily. And we need to rotate more and more outsiders into government oversight, into these agency oversight positions. We need to have people like Martin and Jay and others be able to come in temporarily who are not interested in the government job, as not and I was not either, who are there for the right reasons and not to cover themselves, to make friends in agencies, to make friends with the media. That's what I saw.
Thank you for that. In the interest of time, we're going to move forward. The next section, we want to talk about vaccine mandates and covering the harms of those mandates. We know the COVID-19 vaccine fails to prevent transmission and infection, and yet President Biden pursued multiple vaccine mandates, and many of those mandates continue in place and are harming our men and women in uniform, harming our first responders, harming nurses, harming the American people who dare to say that they don't want to have a needle stuck in their arm or they lose their job. And so I think we ought to have at least a little bit of a conversation about that. I promised my friend from Arizona that we would play a video that he wanted shared that I think he put together. So we're going to put that. It's about a 2-minute video, and I'll forego my questions so that the video can play, and then I'll turn it over to the gentleman from Arizona and then the gentleman from Georgia.
Right now in the United States, people should not be walking around with masks.
A dispute over a mask led to a woman being tased by a cop at a middle school game.
It was a tense first day of class. Police were called on campus. The entire school went into lockdown, and all because 2 students refused to wear a mask.
Suggesting we declare a pandemic amnesty. Quote, we need to forgive one another for what we did and said when we were in the dark about COVID.
We changed our whole culture and of America that'll be a generation or more to overcome.
Record low reading and math scores reveal the impact of school shutdowns.
New test results show a significant drop in test scores and learning for elementary school age children in the United States. The decline in reading and math for 9-year-olds were the largest in several decades.
I'm really criticizing science because I represent science.
Well, the vaccines provide strong protection for the vaccinated. My message to unvaccinated Americans is this: our patience is wearing thin.
I knew these vaccines were not going to protect against infection.
People who have already had the virus be recommended to get the vaccine as well.
The answer is yes.
But she's had the flu for 14 days. Should she get a flu shot?
Well, no. If she got the flu for 14 days, she's as protected as anybody can be, because the best vaccination is to get infected yourself.
Reactions would be most common from these vaccines?
Well, generally, the most common reaction is what you see with most any other vaccine. A sore arm, a little bit aches, you might feel a little bit fatigued and down. A small percentage of the people might get a fever.
It has turned out to be more of a serious issue than previously thought. We're talking about myocarditis happening to some young people after getting the coronavirus vaccine.
From Arizona.
I thank the gentleman, and I thank again all of you for being here today. We saw in the video Dr. Birx admitting that we knew that the vaccine would not prevent transmission, right? And I'm wondering, with with the reports on the VAERS system, the damage a normal vaccine. How did this happen that in an emergency situation we got such bad information, and now we are still seeing individuals forced to get vaccines, while at the same time they're saying let's just forget it, let's forgive and forget about it and move along, while they're still enforcing this. I guess my question is, how did this happen? And then how can you provide forgiveness and move along while you're still being imposed upon against your rights? And I'll ask each of you that.
All right, I'll start. Number one, I think it's a false assumption to believe Dr. Birx's statement on that. that she knew the vaccines weren't going to stop in
So
transmission.
she was lying.
They don't stop transmission, so it's pretty easy to say. I don't know if she's lying. I'm not sure the veracity of the statement, so I think it's sort of an irrelevant statement. You're right. There are these completely irrational pseudoscience-based mandates, particularly on university campuses. I mean, this is a disgrace. By the way, the United States was an outlier of our peer nations in closing schools in the fall of 2020. Almost every peer nation opened schools. They knew the data. The studies were there. It was a lie to claim that we didn't know if schools were safe to open or not. The universities have completely lacked an ethical way of operation by requiring young, healthy students to get vaccinated, boosted, tested, and isolated on a positive test. This is still going on, as you rightfully put, in hundreds of our universities across campus. And, you know, I agree. We cannot just walk away. As I said in my long-winded opening remarks, you know, there is no time for, quote, amnesty. First of all, amnesty, I don't even understand the concept here. There is a very important, there are three reasons why we cannot have just forgive and forget, let's move on here, nothing to see. The first reason is American people must know the facts. We live in an ethical society. They have been through a lot, including but not limited to the harms to their children. They need to know the truth. Number two, we need to restore trust. Everyone who's married knows it goes a long way to admit you're wrong to restore trust. And it's very important that we have a public admission, because we must have trust regained in these institutions, or we can't function in what's supposed to be an objective and very diverse, large society. And then the third reason is the accountability issue, because not for punishment, in my view, but because we can never let these people go unaccountable, or they will do it again. There is no question in my mind that if there is, I agree with Representative Perry, if there is no accountability, this will happen again. The people who are in power need to be held accountable some way, because there will be another pandemic. There will be other crises. There will be other public health emergencies called, and I think everybody understands that, whether or not they're emergencies. So we absolutely cannot just walk away. We need to have accountability, and it's not clear exactly how to do that.
There is one amnesty that I'm very much in favor of, and that is that every person who was fired because they didn't take the vaccine should be rehired with back pay. That's an amnesty that I'm very much in favor of. I think they were badly treated for unscientific reasons, and I would also include students in universities who were prevented from studying, that they should be readmitted and be compensated. You brought up the VAERS system. So VAERS system has its purpose, but it's not the best system for vaccine safety that we have in the federal government. There are two other systems that are the strength of our vaccine safety system, but that we have heard very little about, even though they have the best data, because the VAERS system is spontaneous reports. So there's both under-reporting and over-reporting. We don't have good denominators data. But CDC has a much better system that's called the Vaccine Safety Data Link System. It's been in place for a couple of decades. And they use electronic health records, so they know these people got the vaccine, and then they have everything that happened to them afterwards. Did they have a stroke? They were diagnosed by diabetes? Did they have a rash or whatever? So they will have the denominator data. So the Vaccine Safety Data Link System that CDC runs is a much better system to evaluate vaccine safety. But we've heard very little about it. They did publish a very important study proving that the mRNA vaccines cause myocarditis, especially in young men. And there have been a few other studies, but we haven't really seen much data from it. And I think it's important to ask CDC, why haven't we seen more information from the Vaccine Safety Data Link during this pandemic? The other system is FDA has a system called the BEST system, It's a more recent system that they have built. We haven't received very much data from that system either. In 2021, in the summer, there was a report, a press release saying that they had a signal about some heart problems from the mRNA vaccines without any data, without any follow-up, whether they actually, because they will continue to look at the data, but there was no follow-up to determine whether they actually was a true relationship or just kind of a false signal. So I think both of these systems, the vaccine data link system and the BEST system that FDA has been underutilized during the pandemic, and I think it's important to ask FDA and CDC why that is and to request better data, because the data from those systems is scientifically much higher quality than from the VAERS.
So Martin addressed the vaccine side effects. Let me address the strategy of using the vaccine. I think the error that was made, like the intellectual error that was made. The World Health Organization changed its definition of herd immunity to exclude natural immunity in 2020, to say only vaccines can be used to create herd immunity. You heard repeatedly people like as prominent as Tony Fauci saying if we had 80% of the population vaccinated, essentially the implicit promise is disease will go away, right? You'll get herd immunity through vaccines. If you have a vaccine that doesn't stop transmission, you can't use it to get herd immunity. In December 2020, I wrote an op-ed in the Wall Street Journal with Sunetra Gupta. What we argued was that we don't know whether the vaccine stops transmission. You couldn't tell from the randomized trials whether the disease, because they didn't look to see if whether it stopped transmission. You just didn't know. It had efficacy against symptomatic infection, but you don't know if you could be used for transmission. So we argued that you should use the vaccine for focused protection. Older people, just as Martin has said, had 1,000-fold higher risk of death. You could use the vaccine to reduce that risk of death, and it's worth the potential side effects because those are likely much less than the protection provided by the vaccine. For young people, that's the calculus is reversed. Instead, public health doubled down on this idea that you could use the vaccine to stop transmission, to get rid of the disease. The vaccine mandates were built on that false assumption. And by July of 2021, we knew that was not going to work with certainty, because countries that had widespread vaccination were seeing big outbreaks. So why did we continue down this path of vaccine mandates that have been so destructive, where so many people lost their jobs and people have lost confidence in vaccines? There's no good answer to that I have to that question. And the fact, as you say, it was still happening now. You're still seeing, students in top universities being essentially forced to get a booster that they probably don't need at risk of myocarditis. I have no idea why we're doing that. It's just a colossal error in policy.
Thank you, doctors. Thank you, my friend from Arizona. Gentleman from Georgia is the next up.
Thank you. Thank you to my colleague from Texas, Congressman Roy, and to Heritage Foundation for hosting this, and to each of the witnesses here. We must address and evaluate our nation's, and specifically our government's, handling of COVID-19, from medical censorship and unhinged spending to unconstitutional vaccine mandates. We have seen our country economically crumble and constitutional freedoms trampled. As someone who has served in the U.S. Navy for over 28 years, I am particularly disheartened by the vaccine mandates placed on our service members. It is unacceptable that service members are being discharged and losing their opportunity to serve our nation because they have a legitimate religious issue with the vaccine. Unfortunately, this medical tyranny hits very close to home, as it is directly impacting my Georgia's 9th District. In fact, my office was recently contacted by a major in the Army from my district who is being forced out of military service for refusing to take the vaccine. He, like so many others, applied for a religious exemption and followed the process set out by the Army. However, like almost everyone, his exemption was systematically denied without explanation. This is unacceptable, unconscionable, and unconstitutional. Yet it's not just those in Northeast Georgia. My own staff right here in Washington, D.C. has been impacted by the Biden administration's medical tyranny. A staff member on my staff just a few blocks away had a full-ride ROTC scholarship, graduated, and should be training as an Army field artillery officer right now. But because he made the decision to not receive the COVID-19 vaccine and applied for a religious exemption, his hard work and service were dismissed, and his constitutional freedoms were violated. After submitting his religious exemption request, He received a generic form letter declining his request, and it is currently on appeal. In the meantime, he decided to join the good fight, and I'm proud to have him on my team as we battle this fight. To be frank, I'm downright disgusted that our service members are being forced out by Biden's woke military. This is unacceptable, and we will not rest until there is justice. My question to you is this. You know, we've talked about young men and the risk of myocarditis. Well, what is the military full of? Young men. Young men in their 20s. So, do you think it was wise for the Department of Defense to force the COVID vaccine on young men and women in uniform?
No.
No.
There's no scientific basis to have that policy. None.
Thank you. I think the decision by the Department of Defense is having an incredible negative effect on the strength of our military. You are seeing a decline in new recruiting. That's correct. In new recruiting, and you are seeing great, fantastic combat officers and combat service members being forced out of our military. It is a disgrace, and that is something that we really need to make sure we fix. Thank you.
I think the gentleman from Georgia, I'm going to go to the gentleman from Kentucky and then the gentleman from Texas in this category.
It seems like we're talking about vaccine mandates in the past tense, but they're still in place. Like, families are being separated at the border, at ports of entry, if you haven't gotten the vaccine. Healthcare workers, the ones who are most likely. Right now we're at, 97% seroprevalence, and healthcare workers must be near 100, yet the mandate still applies to them. And there's the one on the military that's still in place, even though there are injunctions against enforcing that for those who've applied for a religious mandate. What seems sort of ridiculous to me is you have to appeal to God to not be subject to their false science. But I want to recognize two attorneys who are here. They got the first injunction against the military on their vaccine mandate. Chris Wiest and Scott Bruins are behind you, Dr. Bonachar. They started with about 80 people at Wright-Patterson Air Force Base, but got a nationwide injunction, which has turned into an injunction on several of the other branches. But it's still in place. And there's no logical reason for it. I introduced H.R. 3860 2 or 3 months before they put the mandate in place. And people say, well, why did you only include the military? Why didn't you include the healthcare mandate or all the other mandates? Because I never anticipated government thought they had the authority to do this to anybody but people in the military who have, signed lots of disclaimers and disclosures. The reason these attorneys are here is my colleague Marjorie Taylor Greene, who left, and Ralph Norman. We decided to sue Nancy Pelosi. We had a mask mandate in the House, which made no sense, but we complied. Until the day she said in the media, we will have masks until every member of Congress is vaccinated. So what was a mask mandate morphed into the vaccine mandate, and so that's why we've filed this lawsuit against her. But here's how I think you could correct it. There's no accountability and there's no liability for mandating these things. We are living under medical malpractice martial law right now, under the PrEP Act. A lot of people think we're under the 1986 vaccine, injury compensation fund regime. No, you can't even apply for that. The PrEP Act, the federal law, overrides all state liability laws. And so, and then there's also been this conflation between EUA and FDA approved, especially in the military. They don't have the legal authority to do what they're doing with the EUA. So it seems like we had these frameworks where before we had COVID, we had sensible things like religious freedom, religious exemptions for healthcare workers who could show that they had a prior infection or antibody levels, for other diseases. To what degree do you all think? Because I'm wondering what we can do in government, right? To what degree do you all think that restoring some sense of liability, either on the employer who mandates it or on the government who mandates it, would sort of fix some of the fake science, Dr. Butcher?
I think that's a great idea. I mean, I don't know why. I'm waiting for some student, some 22-year-old young man to sue some prominent university because he got myocarditis because he was forced to take the vaccine. I don't see why the people that put those mandates in place shouldn't face some liability, even if Pfizer doesn't face it. I think actually there's an irony in what you said about the healthcare worker mandate. A lot of nurses left the workforce because of the vaccine mandates, and now we're seeing shortages of healthcare staff. So what started out as a policy to preserve healthcare capacity has turned into a policy that has destroyed healthcare capacity.
Do you have any thought on restoring some kind of liability for, if not the manufacturers, the actors who carry this out?
Well, I guess I would have, I don't know anything about law, but I guess I would have thought that the temporary there was a reason to sort of limit liability temporarily. I'm just speaking from common sense when you have a healthcare emergency. But I'm not sure why after 2 years, when there is no healthcare emergency, when we've had, by the way, almost 1 billion injections of these vaccines worldwide, 1 billion, and we still don't have a very detailed handle on the side effects. There's something wrong there. But I'm not sure why that permanent lack of liability somehow is persisting. And it is counter to the public good. And since the laws are supposed to be for the public good, they sort of don't make sense to me.
I think, gentleman from Kentucky, and because we in Congress, again, just a different way, I'll just mention that I introduced the HR 6649, which bans the mandates and restores service alongside my friend, Mr. Massey's from Kentucky. Doesn't matter whose bill it is. It's ridiculous that we're not fixing this. It's absurd, facially absurd what we're doing to our men and women in uniform. It is facially absurd what we're doing to the nurse who was basically in tears at a function I held last week in Texas in a small town where she was concerned she wasn't going to get a religious exemption and that she would lose her ability to be a nurse. We're losing nurses. We're losing our men and women in uniform. It's avoidable. It's actually wrong, and we should end it. And the gentleman from Kentucky has a follow-up, and then the gentleman from Texas.
Yeah, to Dr. Koldorf's point about the complete denial of natural immunity, especially in the context of the military vaccine mandate. If you go back, people rationalized it because General George Washington used a smallpox inoculation. But if you go find his documents ordering these things, he said people who haven't already had smallpox. And so I called Mount Vernon, which is the repository of all things George Washington, to find out if he got the smallpox inoculation. And the expert, they put the expert of all things George Washington on the line, and she was offended I would even ask the question because he had already had smallpox. She's like, why in the world would he take it?
Maybe we should put her in charge instead of
the CDC director.
Exactly. Gentleman from Texas, my good friend, Mr. Gomer.
Thank you, and I really appreciate my friend from Texas for getting this together. Appreciate y'all being here. With regard to the vaccines, I'd seen about a Swedish study. Actually, it says of all the vaccines, but the conclusion says our study is the first in vitro study on the effect of COVID-19 mRNA vaccine BNT 162b2 on human liver cell line. We present evidence on fast entry of that vaccine or of the mRNA into the cells and subsequent intracellular reverse transcription of the mRNA into DNA. Are y'all familiar with that study? Should that concern us that the mRNA is rewriting to DNA?
So I've read that study. I think it's an in vitro study, means that it's not something that's been found in real life. It's in like a petri dish or something. Mm-hmm. I'm not particularly concerned about that because I would want to see that show up in epidemiological data with real life outcomes. What I'm much more concerned about is things like myocarditis, that show up with patients, that show up in the signals that you see in these vaccine safety epidemiological systems. The fact that the mRNA vaccine can, in some lab settings, sometimes turn into DNA in liver cells where we don't know what the consequences of that are. I mean, because you have the DNA.
Well, it said in each circumstance that's what happened.
Right, but so let's say you have reverse transcriptation. It turns into DNA into some liver cell. The liver cell could still just be fine. Like it doesn't mean that it's going to be producing spike protein for the rest of time, because just because you have a gene doesn't mean the cell is always.
But then, wouldn't that cause you to want to study this further to see what the ultimate effect would be? Because it could be problematic, correct?
Yeah, I mean, I agree with you. You should study it. I mean, I think this is one of these things where I think one of the editor of the New England Journal of Medicine, one of the vaccine approval meetings, he said that you're just going to have to approve the vaccine to see what its safety profile is, something like that, right?
Goodness.
But it's just to be fair to him. Just to be fair to him, I mean, it is true. Like any vaccine, and you learn about it in its use. So after it's approved, because even if you do a study of 40,000 people, and then you turn around and you give it to 1 billion people, you're going to learn a lot more potentially from the 1 billion than you are going to for the 40,000. The real problem is that we haven't taken the vaccine safety signals we've seen seriously enough. Like for instance, myocarditis in young men. And that we have not taken the uncertainties about whether the vaccine can be used to stop transmission. So we haven't taken that seriously enough. That there are like these curious biological findings. I think that's really important that we continue to study those. Maybe I'm wrong. Maybe it is something important. My impression from that study was that it's a curious fact, but not something clinically important. But
it should be researched further. Right?
Absolutely.
And then there was in August that the following metallic elements were found in all of the vaccines, the mRNA: cesium, cobalt, chromium, cerium, gadolinium, silicon. But my exposure to those have been, as a litigator and a judge, litigation about some of those things causing some very terminal situations. Does that study cause any concern? I mean, how would these type metallic substances end up being in the mRNA vaccines?
I mean, I think that like a lot of that, I don't know the particular that study. I've not read that study, so I shouldn't comment on it. But I'll say like the typically with vaccines, counterexample, you'll have adjuvants in order to modulate the response to it. And it's not necessarily wrong to have those adjuvants. It's just part of how you do vaccine science. Whether those particular adjuvants result in clinical consequences, that's, to me, it's more important to look at that, right? Is it actually harming patients? I've not seen any convincing clinical data that those, whatever adjuvants there are, is the reason why. Whatever the cause is, this vaccine does cause myocarditis in young men. That is, we know that for a fact, not from these biological studies, but from the epidemiological systems that we have in place. To me, that's the more important thing. Let's look. We should have more transparency about what studies have been done to look for clinical signals that meaningfully affect patients' lives, and we haven't had enough of that, I think.
But that is from short-term study and analysis. We don't know the ultimate long-term effects.
So the systems that Martin talked about earlier, the VSD system in the CDC and the BEST system inside the FDA, they actually look at longer-term outcomes. They track patients over a long period of time, either through electronic health records linked over time, or with medical care claims data. And they can track patients for years, actually. So we have systems in place to look at them. Just that the CDC and the FDA are not quite as transparent as they ought to have been in telling us what signals they found, other than the myocarditis signal that they reported.
Thank you.
Can I just add, though, that comment that Jay just mentioned that was made by the New England Journal, We just have to test, they have to inject it to see if it's safe. Okay, this was an FDA committee meeting on the approval specifically in children. Okay, other countries, our peer nations in Western Europe, have made the decision, looking at the data on the risk of the disease to children, that they don't recommend injecting vaccines for people in teenagers under 20. Several other countries. The United States still has mandates on almost every university campus for these kids to get vaccines. Okay, there is an ethical breakdown here.
Well, thank you, Doctor. Yeah, sure, Dr. Harris.
Just very briefly, I'm going to ask a kind of scientific question about this, because it's not only just whether myocarditis exists or not. Look, I don't know. I think you get myocarditis with COVID anyway. But it almost doesn't make a difference now, because if I'm correct in my reading of literature, if you look at, because Representative Massey talked about antibody positivity, but they're different antibodies. And if you look at antibody positivity to nucleocapsid antibodies, my understanding is that very near 100% of the population has it. Because I got to tell you, I don't know anybody who had the vaccine who hasn't subsequently had the disease again. And I'm talking about symptomatic disease, because we know there's a lot of asymptomatic disease. So my first question is, and maybe Dr. Atlas, what's your reading of the, the antibody positivity showing that you have actually had the disease? What approach should approach herd immunity?
I'm going to let Jay answer, because he's done a big sero
study early in
and if you need to have boosting of that protection, antibody response and perhaps T-cell response to only one part of the spike protein. Harmed by exposing them to a vaccine before you have the natural disease, although as you suggest now almost everybody has the natural disease. So this policy was poorly thought out, because in the days before everybody has had exposure, you actually could be causing harm to people in lower. Is my analysis wrong in that?
I mean, that's definitely a theory that I've heard. I don't know for certain that's true, but I will say this. Versus benefits to low risk populations, low risk in terms of COVID mortality risk. It doesn't clearly favor the vaccine, right? For children, for instance, whereas for older people, I mean, I think you could make a case that it would probably did. Now, though, it's a very different situation, as you say. It's like near 100% of the population has immunity, both by COVID exposure and then also by the vaccines. There's no. We shouldn't be talking about it the same way we talked about it in December of 2020.
Right. And in fact, with regard to the military, this is the lowest risk population in that age group. Am I correct? I mean, look, they screen you out for obesity. I know it's in the military. You can't have a lot of the risk factors, the high risk factors. If you have autoimmune disease, you're not getting into the military. So this is in fact the lowest risk of that age group, with the only people in that age group to have a mandate. Effectively.
Yeah, there's no good reason to require meals.
Yield back.
Thanks, Dr. Harris. Thanks, doctors. I know the most important section we want to talk about, and we're past time already, but we talked about this before in planning this, is where do we go from here? So I'm going to ask an open-ended question to the three of y'all to talk about where we go from here. It's important that we have accountability. It's important that we know where to go in terms of never letting this happen again and making sure that our next response is proper. We've talked a little bit about what we need to do. We don't need to rehash that in terms of accountability, but I do want to hear from each of you, because we talked about how important it is about the direction we want to go. Whichever one of you wants to go first.
I don't want to start. I think we've seen the House actually conduct a review of the COVID response, and it was an entirely partisan document aimed, as best I could tell, to attack my friend and colleague, Dr. Scott Atlas. It was entirely unfairly. What we need from Congress is an honest COVID commission, an honest evaluation, and not just with folks on our side, but also folks from all over who made the decisions, put in the hot seat, asked, why did you make these decisions? What were the justifications? What were the consequences? We have to have almost like a church commission or something on the COVID response. Just as I think we're going to get one in terms of the origin of the virus. We need the same kind of attention paid to the response to the virus. The regulatory responses to this, I think, reforms to this also, I think, need to happen. So, for instance, you had Tony Fauci and Francis Collins effectively use their perch on top of the NIH as if they were popes. High scientific clerisy dominating the minds and utterances of other scientists and people. So you can't have that. You cannot have someone who sits on top of such a large pile of money that controls the careers of countless scientists have so much say in health policy. It's a direct conflict of interest. So my idea is, why not have 6 or 7 regional NIHs? Right, so there's great scientists all over the country. Why is so much of the money going to Massachusetts and California? You should have a setting where scientists, the NIHs, compete with each other. So if there's going to be one Tony Fauci, let there be 7 Tony Fauci's competing with each other for the thing. That's better than
wait a minute. But if we have 5 or 6 regional, then even if we have one Anthony Fauci, we have the other 4 and 5 that actually operate properly. So that's the idea.
Like, competition is as important in science as it is in economics. The CDC needs to be fundamentally overhauled, not in the way that the CDC directors tried to overhaul it, I think, because really there are some great scientists at the CDC, but I have not seen great science come out of the CDC. And so the question is, what I have seen is political meddling inside the CDC, as I mentioned earlier with the teachers unions. I think there needs to be an overhaul of the CDC that gives more power to the scientists so that they can speak up when they have problems. The FDA, I think. It saddens me to say this because I've worked for almost a decade with the FDA on vaccine safety, but the actions of the FDA that I've seen look to me like regulatory capture. So you can revisit acts like PDUFA that have pharmaceutical companies financing the FDA operations, things like that. We have to have an independent FDA. It's absolutely vital for the American people to know that the FDA is acting independently of the pharmaceutical companies that they oversee. And I'm not confident that's true during the pandemic.
Thanks, Dr. Bhattacharya. Dr. Kolar.
Yeah, so I think breaking up the centralization of science is critical. And one of the things that Dr. Bhattacharya said is to have multiple funding agencies instead of only one NIH. And that could be then regionally. There are also other things. Now when scientists apply for grant, they're writing a proposal of what they're planning to do. I think a much better system is to write in the papers the research they've already done and then judge them based on that. And then once they have, and if that's good research, they're very likely to do good research in the future. If it's bad research, they're likely to do bad research in the future. So to base funding decision on past work, I think is better than to base it on future promise, because that becomes much more fuzzy and difficult to judge. I also think there needs to be a reform in how publication system works. It has to be open access. It has to be open peer review. And there shouldn't be prestige in being in particular journals. People should just publish it as soon as it's available and then have other people comment on it. So I think, and all of this is sort of part of trying to decentralize science instead of having it very centralized, because I think it's the centralization that has really harmed us during this pandemic. Scientists have to feel free to express their views and have debates and discussions. So when I post something on Twitter or LinkedIn, of course, if an anonymous person says something stupid about me, it happens all the time, I don't care. But when scientists start to bully and slander or take down other scientists, that's not appropriate. That and I've been speaking out regardless anyhow, but it hampers other people's willingness to speak out, and that is absolutely detrimental to science. So I don't think we can accept that we have universities with their faculty members who are bullying or slandering other scientists, because that stimulates the whole scientific debate.
Thank you, Doctor. Dr. Alice?
Yeah, I will echo some of these comments and add some others. I think we really need to eliminate career bureaucrats from heading our science and government agencies like that, but also the people below the top level. We need to have, if you want to say term limits on these points, we need to have more introduction of outsiders whose careers do not depend upon their government position. You can't, because that causes perverse incentives that are nothing to do with science. We need to, I agree, decentralize and depoliticize science. Just to explain why that's so important, I'm not sure everybody understands. Every single academic scientist's career depends upon getting essentially NIH grants. You can't have a career and advance your career. All of us have had NIH grants. If you don't have NIH grants on your CV, you can't get promoted in the university science department. And so you're not going to see a lot of assistant professors, entry-level professors, start criticizing the heads of the NIH. I mean, that's career suicide, or at least they're sensitive to that. So we need to, I agree, decentralize the research funding. By the way, the same people who are in charge of the funding are in charge of the scientific journals. And they're also in charge of the whole university department's office. So it's a cartel of people who not only control the careers and the funding, they also determine what is useful to fund. And so regular scientists at universities, they often see, okay, what is the area to fund research? And then they do their research in that area, even if they don't want to necessarily, because they need the NIH grant to get their career going. So there's a very complex way science is structured that controls research, and that is why we all believe that it needs to be decentralized. We need to tie the hundreds of millions of dollars per year that universities and university medical centers receive in taxpayer money to assuring the public that they're using that for ethical studies. I find it questionable to do a clinical trial for an emergency experimental drug like these vaccines in infants and toddlers, yet they are done in university campuses. I think we should think that through here, and we need to also tie that hundreds of millions of dollars in funding to assuring the public that the free exchange of ideas is visible and encouraged and not thwarted, because the free exchange of ideas is necessary to derive scientific truths. Without it, we are finished as an objective society. And then we need our university leaders to be accountable. There are more than 60 university presidents in private schools alone, more than 60, who earn over $1 million a year. Yet almost all of them, if not all, were complete cowards in ensuring freedom of speech. Not only that, but they also mandated vaccines. The CDC, as a digression, in October of 2020 had on their website, quote, "It is illegal and unethical to require testing of students." We advanced very quickly beyond required testing to injecting experimental drugs. And by the way, that's been removed from the CDC webpage. And then lastly, I want to say this. In the end, we need individuals. We need good people to step forward. We need to embolden other people. I think one of the things that we have all done, if we've done anything, is to take some heat so that other people could step forward. Most people actually are reasonable, ethical people in the United States of America, but they're afraid. And and I understand why they're afraid, believe me, but we need to do whatever we can to ensure that the freedom of speech, the free exchange of ideas, is not going to be met with intimidation, bullying, death threats that we have all had, because most people are not going to respond and volunteer. And I think the future of this society depends on good people stepping up.
Thank you, Dr. Atlas. Any of my colleagues, Mr. Massey, Mr. Biggs, Dr. Harris, Mr. Gomer?
Yeah, Dr. Koldev, I take it by your comments you're not in favor of what was done to Galileo.
I have a follow-up on that.
I'll allow you to answer, sure.
It took 359 years for the Catholic Church to formally admit that the earth moved and Galileo was right. I'm taking the over on how long the lockdowns are going to take to admit they were wrong.
Actually, can I just say one thing about that?
Mr. Massey?
The Great Barrington Declaration was nothing new. Galileo said something revolutionary and new. We said something that was known for a century. It's how we manage old pandemics. So we don't need to go back to Galileo. I mean, it was just what we did was just wrong from the get-go, and it was clearly wrong, a deviation from standard pandemic responses, and we need to find out why.
Thank you, Mr. Massey.
I just want to say, in the beginning, the smart people understood what was going to happen at the end of all of this, that the politicians would say, we trusted the scientists, and the scientists were wrong. And so the politicians would get off the hook. And then the scientists wouldn't be on the hook. They don't get elected. They're not voted on. And that's the problem that we have. And people were predicting that within the 15 days to slow the spread, right? Yeah. That was the prediction that people made that is coming true right now. And I think it was Dr. Atlas who made the point. It's up to the people who vote to hold the politicians accountable for trusting the garbage science, for listening to the garbage science when they had gold science telling them that that was garbage science. Politicians aren't expected to be scientists, but they're expected to make judgments based on advice. And they just failed to do that. They failed to get the right advisors. And I thank you all for speaking out and being the right advisors all along that should have been listened to. And thank you, Chip, for holding this, to making sure that we don't forget. I mean, we can't just, Dr. Atlas is very charitable. He doesn't want to go, prosecuting people and whatnot, but we do need to hold them accountable, to his point. And we just can't forget. We need to, and I know that's why you had this hearing. There's going to be a lot of, hey, let's just move on. And we don't necessarily need to put people in jail, although I'm not against it. But we do need to hold them accountable.
I will, unless there's anything else from my friends from Arizona or Maryland, I just want to say thank you, not just for being here, gentlemen, today, taking the trip across the country and from different places and other events that you had here in D.C. today. Thank you for being willing to stand out and say the truth when a whole lot of the world was against you, when you were being censored, when you were being silenced. Thank you for doing that. It's been critically important to have your voices out there, to be able to inform what we're trying to do to get the truth to more Americans so that they can know what their government, frankly, has done to them. That's what we're here to talk about. That's what we're here to expose. On January 3rd, a Republican majority has an obligation, a duty, to bring forth and the truth for the American people about what their government did to them through the power of government, sharing misinformation, the kinds of things that this country has always stood athwart. This country's greatness comes from our dependence on truth and seeking the truth wherever it may lead, to quote Thomas Jefferson, to ensure that the rule of law exists and is strong, and to put those ideals above individuals. We put our faith in principles, not in princes, and that's where we've run awry. We objectify individuals. We have people going around, worshiping at the feet of a bureaucratic doctor, making claims, and we've gone through that here today. But it is critical that we seek the truth. It's critical that there's accountability. This is step one. Your presence here today is extremely helpful. I want to thank the Heritage Foundation. I want to thank all the staff that were involved with this, all the people that helped get the videos out and all this stuff on social media. I want to thank all those that are watching online. I've got a lot of social media that people are watching online. I want to thank Fox News and others that are here to cover it, and all the reporters that are here. We'll be happy to talk to you afterwards. But again, thank you all very much, and God bless you.
Thank you, and
Thank you.